Dr. Bolajoko Aina has introduced from Department of Clinical Pharmacy, Faculty of Pharmacy, University of Lagos. I'm talking on relationship between BMI, perception of weight, and methods of weight reduction among pharmacy students of University of Lagos. As a part of introduction, obesity is associated with many diseases, as we have heard since yesterday, or that we have read one time or the other. It is a leading cause of death worldwide, and there are two main causes of obesity: diet and lack of physical activity. Now, as pharmacists, role of pharmacists in management of obesity include raising awareness and providing information for clients or providing advice, referring patients to specialist services for those that require such services, like surgery, use of drugs, and even diet. Then reviewing and maintaining progress for those that have started, maybe that are on diet or any drug, want to review whether they are making progress in their weight loss or weight control. So we can say, therefore, that pharmacists should advise on weight control products, should advise on eating habits, physical activity, and a healthy lifestyle, especially for patients or clients who want to maintain their weight loss. So the objective of the study was to determine the perception of pharmacy students who are future pharmacists on their weights and method of weight control. We believe that their method of weight control will influence the advice they will give to clients or patients that come to their pharmacies for advice. So if they themselves are not doing it right, how will they be able to advise the clients or patients coming to the pharmacy? Method: we use a modified version of CDC Youth Risk Behavioral Surveillance System. We use the questionnaire, the one designed for 2011. This questionnaire was self-administered to pharmacy students. The students are actually consented to fill the questionnaire. It wasn't all the students that actually participated. About 450 students consented to fill the questionnaire, and out of these 445 questionnaires were eventually used for analysis. SPSS 15 was used for the analysis. Now, a brief description of what the Youth Risk Behavioral Surveillance System is all about. It's a system that monitors 6 categories of priority health risk behaviors among youth and young adults. And we believe that the pharmacy students actually fall under the age group of youth or young adults. And the 6 categories of priority health risk include behaviors that contribute to unintentional injuries and violence, tobacco use, alcohol and other drug use, sexual behaviors that can contribute to unintended pregnancy and sexually transmitted diseases, including HIV infections. Then unhealthy dietary behavior, their eating habits, and the physical inactivity or physical activity. And in addition to these 6 categories of health risk behavior, the YRBSS also monitors the prevalence of obesity and asthma. The questionnaire actually has about 97 questions. So you have different numbers of questions addressing different health risk behaviors. But for our study, we extracted data on the relevant questions, which are: how do you describe your weight? Which of the following are you trying to do about your weight? Like, how do you describe your weight? The student can say, okay, I'm slightly underweight, or lightly underweight, or slightly overweight, or lightly overweight, or about right weight. Then also, which of the following are you trying to do about your weight? Whether the student is trying to maintain the weight, or lose weight, or even add weight or gain weight. Then in the past 30 days, did you go without eating for 24 hours or more, which is also called fasting, to lose weight or to keep from gaining weight? During the past 30 days, did you take any diet pills, powders, or liquids without a doctor's advice to lose weight or to keep from gaining weight? Then during the past 30 days, did you vomit or take laxative to lose weight or keep from gaining weight? And then lastly, during the past 7 days, on how many days were you physically active for a total of at least 60 minutes per day? The student can add up all the time spent in any kind of physical activity that increase the heart rate or that make the student to breathe hard for some time. Results. From the questionnaire, we found out that about 70% of the students described themselves as having the right weight, while only 1% described themselves as very overweight and 13% as slightly overweight. Excuse me. The mean BMI for those that described themselves as being very overweight was 34.67, while those that described themselves as very underweight had a mean BMI value of about 18.24, and this one tally with the classification of BMI. Then all those that described themselves as being overweight were actually trying to lose weight, while about 82% of those that described themselves as being slightly overweight were trying to lose weight. And among these the very overweight and the slightly overweight, 40% of the very overweight went without food for 24 hours, 20% took diet pills, none of them vomited or took laxative. But for those that are slightly overweight, 30% of them went without food for 24 hours, 10% claimed they took diet pills, and 9% either vomited or took laxatives. Then among all those that were trying to lose weight, only 22% of them were involved in physical activity on all 7 days before the survey. Let me see whether I can get this one. Okay, the summary, the result I just mentioned, just summary of this, but put it in graphical order. We have the gray portion indicating the result for people that the students that claim they were very overweight, and the brown portion for those that are claiming they were slightly overweight. So from here we can see that 100% of those that were very overweight were trying to lose weight, while 85 were trying to lose weight for those in the slightly overweight category. Those that went without food for 24 hours, 40% for the overweight and 30% for the slightly overweight. Those that were taking diet was 20% for the very overweight and 10% for the slightly overweight. And then those that vomited or took laxative, none of the very overweight, but 9% of the slightly overweight. And then their BMI, the average BMI for those in the category of very overweight and those in the category of slightly overweight. Also, this one is telling us about the frequency among the students, as those that claim they were very underweight, and then their average BMI for those category of students. Now, for those that claim they were very underweight, only about 2% among the students, and the average BMI was 18.24. The slightly underweight, 13.8% among the students, and average BMI 19.34. Claiming right weight was 70%, and the average BMI 21.39. The slightly overweight, 12%, and then excuse me, average BMI 24.64, and then the very overweight. From the result of this study, we can say that obesity isn't much of a problem among the students, and of course it is not unexpected. If we compare the diets over there to the diets in US, we shouldn't have much problem of obesity or overweight down there. But the eating pattern is changing gradually, but so far we don't have much problem of obesity or overweight with the pharmacy students under the study. But the few of them that are overweight should be encouraged to employ right methods of weight control. They shouldn't be involved in issues of vomiting or taking laxative, for instance. They should be more involved with physical activity as much as possible. We have some limitations in these studies. The responses were actually subjective. So it is what they told us that we considered. For instance, the BMI was not measured, but part of the questions in that questionnaire included telling us about their weight and about their height, which we eventually used to calculate the BMI. We didn't actually take the measurements ourselves. So if they've given us wrong values, we had to do with those values. So that could be a limitation. Then the issue of no responses. Part of the reason why we couldn't use all the questionnaire, because those questionnaires we didn't use eventually, we didn't have complete information. Acknowledgements. We sent the ethical committee of the Faculty of Pharmacy, University of Lagos, the pharmacy students that consented to participate in the study, and then the staff in my department of clinical pharmacy and biopharmacy, and CDC, allowing us to use the questionnaire. There's no restriction in using this question. Anybody can use this question. Though you can restructure it to suit your situation. For instance, we didn't use all the 97 questions. Eventually, we ended up with 94 questions. Then we had to modify some of the questions. For instance, issue of cycling. Cycling is not something popular in our area. Though there's another form of cycling, which is using of motorbike, but that is on commercial basis, not individual basis. So we had to reframe some of those questions. These are some of the references, and I will say thank you, and this is my email address.
Thank you. The time for the question to Dr. Aina. Okay, I have a question. I may not fully understand your study, but I was curious why the subject did some of the vomiting or the diet or take some pill. Why did they take those kind of...
It's like human behavior. People have different ideas of how to achieve weight reduction. Some people believe that if, for example, if you use diuretics and you urinate regularly, that you can lose weight. Some people believe that if you take medication that can make you to vomit, then you don't have much food in your system that can be absorbed and make you to gain weight. It's just their own idea, but which we need as medical personnel to counsel and advise them that it is wrong. It's not the right thing to do, but you have people doing different things to achieve different things, but which you need to actually educate them on.
So you didn't control those kind of behavior, right?
No.
Before the experiment, okay.
So eventually, after the study, I went back to the students to tell them this was what we observed and it was wrong. And actually, we're planning to put some of this in some of our lectures in my departments.
Actually, I think, wasn't it 0% that vomited in your very overweight group? So
that is none of them claim
none of them did, so
sorry?
That wasn't the problem.
Sorry?
0% vomited.
Yes, that is for that category of students that they didn't get involved with the vomiting in order to reduce weight. It's just because I was trying to compare with very overweight and the slightly overweight.
Right, thank you for your presentation, Dr. Aina. Here's a certificate for you. Okay, here's the next, last presentation for this session. Dr. Olavis Akiula from Nigeria. The title of the presentation is Glycemic Index of the Selected Nigerian Food for Obese People.